In several of the last couple chapters, they've mentioned stroke, and so I thought we should have a little discussion of stroke. It's one of the most common and most severe problems that affects the nervous system. Uh, there are really two types of strokes. They're often referred to as cerebral vascular accidents or CVAs, and these two types of strokes have very similar effects. They disrupt the flow of blood to the brain, but they have different causes and different treatments. The most common type in the United States are strokes that are caused by the formation of a blood clot in one of the blood vessels that leads to the cerebrum. These clots block the flow of blood, and so the flow, not only the blood flow, but then oxygen can't reach the brain tissue. And if that flow of blood remains for a period of time, then brain cells will die and function will be lost. A similar effect occurs if the blood vessel breaks and you have bleeding or hemorrhage into the brain. In that case, though, there's an increase of intracranial pressure and then the disruption of blood flow because of the loss of blood. And so this has to be repaired, but usually, again, there's the removal of clotted fluids in brain tissue and then the reestablishment of blood flow. In both cases, it's really important to do this fast because cells die. Sometimes people have small transient ischemic attacks, or TIAs, where there's a temporary formation of a clot that then dissolves in a little bit of time. But they'll get similar signs. In either case of a clotting stroke or a hemorrhagic stroke, there are discrete warning signs: numbness or weakness in your face, arm, or legs, and usually it's only on one side of the body. So loss of sensation on one side, being paralyzed on one side, having difficulty understanding speech or trouble speaking, altered vision, loss of balance or coordination, dizziness, or severe headaches. Okay, strokes are usually affecting the cerebrum. Not that it can't affect another part of the brain, but usually if this happens in the brainstem, people die pretty quickly. So this is usually going on inside the cerebrum. The most common types of strokes are strokes caused by inappropriate clots that form in the blood vessels leading to the brain. Okay, these are usually associated with risk factors. They increase with age. High-fat diets with highly processed foods, lots of saturated fats, things like that. Lack of activity. What's really important, no matter what type of stroke, is rapid diagnosis and treatment. Usually, if it's a stroke that involves the formation of a blood clot, we can give clot-busting drugs very quickly. And those drugs will start breaking down the clot. Maybe that might be enough that it can stop the stroke right in its tracks. In many cases, though, we'll have to use imaging and then go in with surgery to remove a clot or to repair a damaged vessel. It's really important that we do this quick because if cells die, nerve cells die, those cells aren't often replaced, and people will have to relearn those activities. Maybe the ability to speak, maybe the ability to move with one side of the body, and so that can be very arduous and take a long time.